Howdy folks, I'm here with Janelle Zabrick, who's a physical therapy specialist extraordinaire, and she has earned her degrees in physical therapy as well as her doctorate in physical therapy from Concordia University. Thus she has her DPT, OCS, as well as a number of other postnomial. So many I can't even remember them off the top of my head. But she is a specialist in orthopedics, particularly sports medicine as well. So it's excellent to have you here because we certainly have a number of patients who have pain, regardless of whether it's from a sports injury or not. She can certainly take care of that. My name is Singa. I'm a pain physician, specifically interventionalist at Plug Spine Pain here in Austin, Texas. And we want to go through a few questions because you are the expert in physical therapy. And oftentimes patients come to us and they don't want to go to physical therapy or they don't perhaps use it to the best of their ability. And so we want to perform a service to the public and community in order to educate them about how important it is. Okay, Dr. Zabrick, so on to the next question. What is physical therapy and what would a first visit look like for a patient?
Sure. So physical therapy is really the art of restoring proper movement patterns by using range of motion, strength, exercise, and manual therapy to reach a patient's functional goals. So in essence, physical therapists are movement experts. We're really good at breaking down movements, evaluating what needs to happen, what's limited, what's maybe excessive, in order to get people back to their goals. So when a patient comes in for the first evaluation, they are evaluated by a licensed doctor of physical therapy. The first part of that evaluation is a subjective examination. This is really important. It's a time where the patient gets to tell us their story, what happened, what's going on, what sorts of treatments they've tried, what's been successful, what hasn't. That really helps give us a good picture of where they're at in their process. The PT will also ask very focused questions based on their symptoms and pain to try and narrow down kind of a differential diagnosis of where we need to take the next part of the exam, which is the physical exam. And I always tell patients, this is the fun part. This is where we get to watch you move and check range of motion, check strength, do special testing as we need to, see how well the joints move, see how well the nervous system moves with the neural structures, doing neural exams, things like that might be indicated on a case-by-case basis. Then based on those two things and adding in what the patient's goals are, because that's our ultimate focus here is getting our patients back to their goals. We're able to come up day one with a treatment plan to get them on their road to success. So that includes education on what's going on, how therapy can help them, as well as starting them on an exercise program day one. That's a very key part of physical therapy and the success of physical therapy. So giving them a tool day one where they can go home and start to feel better is really, really important. So that's what a first visit looks like.
It's amazing. So it sounds to me that there's more than just the patient coming in and you directing them towards some sort of exercise to do. You do your own exam, you really are, as you said, tailor it to them. Would you find that, say, they're referred for low back pain with radiation down the leg, like they call it sciatica, that say you think it's something else, what would you do? Would you adjust the kind of therapy? Would you reach out to the referrer and say, well, I think there might be this component also? Or would you kind of work on only the one thing that they were referred to?
Well, with physical therapy, I think one of the things that we do really well in the PT world is we really treat what we find. There's times where people get referred for And you've probably seen this in your practice too, like for like foot pain, like plantar fascia or something like that. And on our testing, we're finding actually this is coming from the low back, where if we just treat the foot, they're probably not going to get better, right? So we really evaluate and do a thorough evaluation, screening all the joints as we go, like for instance, the back, the hip, the knee, all the way down to make sure that we're confident with which structures we feel are involved. If it's something that is, we feel completely or that is very significantly from what the physician has sent over, yes, we will reach out, we'll send a note, we'll call, and we'll collaborate with the physician. If it's pretty close and it's, within the same kind of treatment, we'll treat them how we would treat and based on what we're finding, based on their movement patterns, and kind of go from there too, and just make sure that they're responding appropriately.
Okay, excellent.